So I am going to call to order the June 25th Recovery Task Force at 4 o'clock, just slightly after. And I'll start by taking a roll call of the task force members in attendance. So please unmute yourself and say here when I call your name. Jason.
Here.
That was interesting, Joanne. I couldn't hear him. Maybe we can try that again. Jason, you were speaking earlier.
Can you hear me now?
Now I can.
You hear
Thank
me
you. Our continuing phone ad joke. Yes, I can. Marisol.
Here.
Thank you. Mike.
Here.
Thank you. Nina.
Here.
Thanks, Nina. Pavel.
Here.
Thanks. Sam, are you on? Trish.
Here.
Brookie is excused today. Grace, are you with us? Janine?
Here.
Shashi?
Here.
Thank you. Marlene? Ron?
Here.
Thanks. And Stephanie? So thank you all for being here. For our visitors today, I just wanted to give a quick little update on what we're doing here. I called together a mayor's task force to help us with the reopening of the community, and these are volunteers who are currently serving the community on a border commission and put their hand up to join another one because they just don't have enough to do and they love this stuff. And some are sort of community members at large that I selected to diversify the backgrounds and thoughts that were coming into the group. So we have a really great group here. They've been working really hard. So for our task force, we do have some city staff today with us and a couple of visitors. Our guests will be speaking later in the meeting, but I would like to thank both Patty Hayes, the Director of King County Public Health, and Chris Bodwin, the Chief Operating Officer of Swedish Issaquah Medical Center, for taking time out of their horrendously busy schedules to spend some time with us today. The city staff on the call with us is Joanne Biscara from the Mayor's Office, our City Administrator, Wally Bobkowitz. I believe Jen Davis-Hayes, who you've met before with Economic Development, may be available to answer questions, and Tim Smith is running the media part of the meeting for us. So the first thing we have is the approval of the minutes of June 11th. Is there any objection to approving the June 11th, 2020 meeting minutes, which were provided in the online agenda? Hearing no objection, the minutes are approved as presented. Joanne, has anybody from the public signed up to speak today?
No, Mayor Polly, no one has.
Thank you very much. We do not have any reports for this meeting, and so we'll move right into our agenda items. And we will start with King County and COVID-19, and I'm really pleased that we could get Patty Hayes today, and surprise, Director of King County Public Health during a pandemic, to come and talk with our group. So Patty, you have the floor.
Thank you so much, Mayor, and it's such a delight to be with you all. I really appreciate it. Thank you to each of you for stepping into this leadership space in an unprecedented time. Clearly, in my career, which has been long, as you can tell from my hair, that I never expected to be needed to lead the efforts on a pandemic. And it really takes all of us, and King County has been a leader in the nation because of the efforts from folks like you and others to really address this. So in my few minutes here, I wanted to give you a quick update on where we're at, and being the Recovery Task Force, give you sort of my vision of what we are going to expect over the next few months, kind of the reality check on what we're seeing. And it is my delight that you're meeting with today because we have really some interesting evolving news coming right now. I think the timing, Mayor, is going to be really good for your Recovery Task Force here to be speaking with me. And I'm trying to myself right now more available to spaces like this to have these conversations. So let me start by thanking Joanne for sending out the link to the dashboard. If you haven't had a chance to look at that, please do. It's been created as a resource for you and the public, but particularly for recovery task forces and those who are working with mayors and local governments to figure out what are we doing, what's happening here. I want to point out a couple of things so that we go into the dashboards, you know what's available for you. And we are continuing to improve these dashboards. And so the look and feel of them right now, if it changes, it's because we are adding more information or we're taking input and evolving it so it's more user-friendly. So on the main data dashboard, that is updated after we get the complete view from the state data and then the local reports from all of the labs, usually in the afternoon, somewhere between noon and 2:30. It provides you with a look on a day-to-day basis over what reports we're getting in on the number of cases. When we do all the fancy key indicator methodology, there's a separate dashboard on those metrics that we're trying to hold to in order to open up more. That methodology is actually based upon the date of the positive test. So the numbers, if you added up the numbers on the daily dashboard, you would be calling me and say, "Hey, those don't match when we see these indicators. What's the math?" I've had a couple of math geeks call me and ask me about that. And it's because our data team is back and we do this methodology based on when the person was actually tested positive. And then we have a whole bunch of information on and around when they became ill and their symptomatology. We do all of that data in. So we have some of that facing to you, but the real difference between the daily dashboard and the key indicators, just at a high level. In the daily dashboard, what I want to tell you we just launched a couple of weeks ago is a overtime geographic piece in there that you can go into. So at the top of the dashboard, you'll see these different tabs. Go into the one that allows you to look over time, because you can look in your specific area over time what the numbers have been. You can track, so you will see we had the big outbreak at Life Care, and we had so many cases that were in the Issaquah Swedish hospital and Evergreen, et cetera. You'll actually see that hotspot and how it's changed over time. You will see now that one of our biggest hotspots on the east side is in the Crossroads area. That's not related to a long-term care facility. And then the dashboard will also give you a look both by race and ethnicity, and we have a whole separate one on that. So the data is there for you, and Mayor, as you move forward, I would love to get feedback from you on our dashboards. I would appreciate that from you and your staff, an email at any time. So let me move now to just give you a quick update. So we moved to phase 2 just a week ago tomorrow, as you know. And Dr. Duchin and I knew that when we moved even into phase 1.5 and into phase 2, that number one, we have taken the approach slow and measured, so that we're watching the data and we're doing this because nobody wants to go backwards. We want to move forwards. But we also knew when we open up that the fact that people are coming together and that we are in a space where we are encouraging and allowing folks to try and get back to normal, allow the economy to reopen, allow wonderful businesses to get going again, that we run the risk of higher levels of infection. And indeed, we knew the numbers were going to go up, and they have been. We are no longer meeting the metrics on the standard for the number of cases over a 2-week period. And that, Dr. Duchin and I knew that we were at risk for this. I don't want you to panic about that, but I do want to say that there's a big difference if we level off and possibly go a little bit better in the next 2 or 3 weeks versus if the spike continues to increase. So we're going to be watching this carefully. And what I would caution the Recovery Task Force that you could really help me with is there's a large expectation by everybody. This has been extremely traumatic. It's been traumatic for families who haven't been able to visit their family members in the hospital and in long-term care facilities. It's been traumatic in the fact that we've closed down businesses and businesses are in such deep trouble. We've lost some wonderful businesses. It's been terrible for the arts community. So the pain, and I really believe this because it's important to me to both know that measure of how we open is a balance between what the science says and what the reality is in your work, the decisions that you need to help make in the community. So with that in mind, I need your help actually, because one of the important things we're seeing is, and there's a lot of reasons why this is happening, but people are very tired of being indoors. They're very tired of, I know I'm tired of being indoors. And if I asked for a raise of hands, I would expect everybody would say, yes, indeed. And as the mayor said, telecommuting and these kind of Zoom calls are for those of us that like to be with people, are really hard and not fun. So people are really anxious to get out. What we're seeing right now is a major shift in the numbers where it is individuals under the age of 40 that are experiencing the larger increase. This is because they are taking higher risk. They're gathering in churches, they're gathering by our parks, they're gathering, having picnic by our rivers and lakes. They are going into some of our restaurants, and we're not practicing enough of our social distancing, our physical distancing, staying home if we're not well, and doing the mask work. And one of the key things that I believe that I have to find a way to emerge, and your help in this and your thinking will be really incredibly important, is how do we help both businesses and actually the faith community and others to embrace this as a community response right now. I really want to work with businesses because right now, if they help me in really being successful with this, even though it's terribly stressful and some very small businesses at 30-40% opening can't make it. It's not economically viable. I understand that. But if we don't really encourage and really help our community to peer pressure, let me say, do the right thing here, and the numbers get bad and we get further outbreaks, we are actually risking the transmission back so that we have another nursing home outbreak. Because what's going to happen is it probably is going to be a young person who does have symptoms or is early on or very light cold-like symptoms, goes out to a park, a bar, a restaurant, a place of business, transmits that to a number of people, and it then goes to the business owner or the person who works in that business. They take it home, and then it's given to grandma. Grandma ends up in the hospital and dies. That's the reality of this picture. People want to feel like the virus has gone away, and it has not. Bill Gates last night on the wonderful, I don't know if you saw All in Washington, the fundraiser last night with the music and theater community, did a wonderful job being hopeful to say we hope to have a vaccine next year. And I hope so too. And with that gives us hope. But between now and then, our best hope is for really aggressively promoting you being my emissaries out with using masks and with encouraging your community members to social distance and do and have their fun, but be mindful of that. To have business owners be our biggest emissaries. And so it's a strategy I'm going to be emerging with the county executive, talking with him tomorrow. I want to partner with the Sound Cities Association, with every mayor around and every recovery team to figure out how we do this, because I really believe right now it really isn't public health. We've been out saying these things a lot. You've had the doctors out saying it. You've had the University of Washington out saying it. I tell you what's going to be effective. It's going to be the young person standing in front. It's going to be the faith leader standing in front of their congregation saying, we love our community. And by loving our community, we're doing these steps. So I hope you will talk about that in your plans and how you can be really the hub for that. Because in your area, frankly, you're not necessarily going to see an uptick in a lot of cases. And you probably already have faced situation where it really isn't here. It doesn't feel like it's here in our community. Well, actually it is. It's working. There are no hard borders. We do not have walls that keep us out. And particularly since you're in an area where it's a wonderful place to shop, it's a wonderful place to come and visit. I want you to have to be like what Europe is doing, which is now saying that Americans are not going to be able to travel to Europe because we're not controlling the virus. We don't want to shut that down like that. So your help with these key strategies will prevent from going backwards, because that's my biggest fear right now is with the uptick, if it continues, I don't even want to have that conversation. I want to focus on how to be successful. That's the conversation I'm having with the executives tomorrow. You're getting the early picture of that. And then I know you had some questions on testing and serology testing. So let me answer them and then open it up for questions. So the idea of antibody testing or serology testing, we are blessed with places like the University of Washington, which is actually in partnership with us, where we are actually in one of the early tests of one of the what we believe will be a viable serology test. And even though Major League Baseball has decided to go ahead and do serology testing, I've been working with them as they look at how to reopen the Mariners. I must tell you that Dr. June doesn't feel we have a reliable serology test for a couple reasons. First of all, the science behind it is still evolving. I'm amazed at how we are learning live time the science on this virus. We started by thinking it was flu-like. It's clearly not flu-like. We thought it was a lung infection. It clearly affects the lungs, but it is a circulatory infection. So when you look at something like a serology test, which is trying to tell you, do you have the right antibodies so that you're protected? You've had it, whatever, you might not have known you've had. That serology test relies on the fact that, number one, it's identifying the correct coronavirus. Coronavirus is actually a family. There's like 5 or 6 of them. COVID-19 is a vicious, really virulent strain that's mutating right now, and it appears to be mutating on the East Coast with a different strain on the West Coast. So these serology tests take a while to get really accurate. So I wouldn't count on that for any of your businesses to use to make sure that they know who's affected and who's not. I do believe that we will see in the next number of months, within a year, a valid serology test, and your healthcare providers will be trained in how to use those so we can do that. So that's the fact on serology tests. In testing, we're trying to really get all of our providers knowledgeable that they should open their doors in a way to test every one of their patients that is symptomatic or has been exposed. We are looking at the gap areas, and we are trying to get what's called open access testing through partnerships like the University of Washington or community health centers to open to folks who are not their own patients So if folks don't know where to go, they can go in open access places. We have a number of those that are in strategic areas. We've just had one opened in the Bellevue area with the partnership with one of our community health centers. And so we're actively watching that. So you can feel free to call me or email me if you feel that access to testing is a problem in your area. We're trying to watch it in the data hotspots. We know we have hotspots in South Seattle and in Shoreline, and definitely in the South End. We just opened an access point for open testing in Auburn. I'll be talking with the mayor about that down there. So we have an idea where we believe there are hotspots. Your input can be really helpful with that. So with that, Mayor, I think I covered the list I was supposed to in my 10 minutes. I took more than 10 minutes, but I am happy to answer any questions from anyone on the call.
Oh, it's fascinating, Patty. You could have talked for another 30 minutes. I love this stuff, and I think the team I've pulled together is as interested as I am. Yes, it's open for questions. So any of the task force members that want to use the chat box, just say, you know, this is Mike, and I have a comment or I have a question. And while we're doing that, I wanted to thank you for giving us a job to do, which is amplify the message. I think what we have been doing is using our government voice, but not necessarily our community voice. So thank you for that. I want to also thank you for the absolutely unbelievable body of work that is happening in literally months. I hope you get to sleep, but I just cannot believe how fast and how hard everybody is working on it. And I just wanted to actually give another message out to our team here, and that is that it's not just the modeling the good behavior, which you mentioned, which is the physical distancing and the mask, but it's the responsible behavior once you've been notified that you've been exposed.
Oh.
I know it's hard to go back in your house. I know it's hard to bring your kids back in. I know it's hard not to go to work. But if we don't have compliance there, we're losing. We're just losing. So thank you for all of that. And I am seeing some questions in here. So let's start with, well, actually, there's a comment from Chris up at Swedish who says, great presentation, nice job. He totally agrees with the serology. But let's start with Jason for a question, and anybody else who would like to have a question for Patty, please put your thing in the box. Jason, you're on.
Okay, well, thank you, Mayor Polly, and thank you, Ms. Hayes, for joining us this evening. My question is, according to the daily dashboard by King County Health, the hospitalization rate as well as the mortality rate in King County appear to be declining. However, the reproductive rate as well as the reported cases appear to be slightly increasing. Can you speak to that as why is this a less virulent strain? Is there something that's happening with the virus itself on the West Coast? And then as far as what is the impact of that information to King County Health officials such as yourself and your decision making, and what will that do as we continue to reopen safely in the region so we don't have to go backwards? As you mentioned right at the very beginning of your presentation, the slow and steady reopening so we don't have to relive this nightmare in 2 to 3 months. Thank you.
Well, thank you. Thank you. This is just a fantastic question. So absolutely correct. The metrics that you just laid out are exactly what Dr. Duchin and I look at. We actually watch things on a running 7-day, if you think of it, a running 7-day sort of data look on it to see these trends compared to before. So let me speak first to the hospitalizations. So the hospitals have done a fantastic job. Talk about somebody that deployed quickly to develop excess surge capacity. They shut down a lot of their services in order, which hurt them economically, incredibly hurt them. So to make sure that they could have the capacity that needed, and for hospitals like Swedish and Issaquah and Evergreen, it was really essential to have that happen extremely quickly so that we didn't have what happened. It's happening right now in California. It's happening in Houston to a good colleague of mine. It happened in New York, and it's happening in Florida. what's happening right now, two things I would say. Number one, the demographics have shifted. And if you think that back that under 40, the virus seems to not be quite as spicy with them. 80% of people will have, light to moderate symptoms. It's 20% the vulnerable people, the children that have pre-existing kind of conditions and immunocompromised. We're trying to protect by this community strategy. So as we saw over the last weeks, and you can see this on the dashboard, it's really fun to watch. I play with that overtime thing, you can tell, probably too much. That as the outbreak shifted to the younger sites, the younger folks, we wouldn't expect a spike in the hospitalizations. But Dr. Duchin cautions that hospitalizations actually lag up to 2 weeks behind the spike. So the spike's been really in the last 7 days, so we need to give another week to really see. And in fact, there was 5 hospitalizations today. That's not huge, but that's up because in the last few days it's been like 1. That's nothing that's scaring me, but we'll watch that very carefully. And then, of course, the deaths, thanks to the work early on by the hospitals in King County and then in New York, and working with organizations like the University of Washington, we've learned a lot about this virus. Yes, the virus is mutating, but that's kind of science wonky for more further out. What's happening right now is we're learning enough that treatment's changing. So in the beginning, we really put a lot of people on ventilators, and we've learned that it's probably the best strategy to not put people quite so, it's hard when you can't breathe. Think about how hard that would be, not have immediate relief, but we're learning that providing oxygen saturation and placing people in a different position to try and avoid putting on a ventilator can really help. The Renciclovir is a drug that got approved that King County, but the whole state of Washington was an early adopter into that, and now the new breaking kind of use of steroids. So we're really, the more the hospitals can learn from each other and move into these treatments, 2 things are happening which are really good. Number one, I'm hoping the stay in hospitals will be reduced because some of these folks ended up in the hospital, and your next speaker can speak much more eloquently to this. But it was so long, it tied up hospital capacity because recovery time or the time till death. We actually watch the data on when someone came into the hospital and what was the time they died, how long they were in it, so that we can watch this hospital capacity to support the hospitals. So we're hoping that 2 things will happen. People will recover faster, but also they're going to recover better because we have better treatments. So that's a long answer to your question, but it's really important stuff.
That's great, Patty. Thank you. We also have Shashi with a question. Shashi.
Yeah, hi. Thank you, Mayor Polly, and thank you, Director, and all my friends. My question is, although you have answered most of my questions, but is it possible for us to get daily data, at least for the new cases and the deaths? I'm really interested in that. I have not got it on any of our websites. And number 2, I was worried about that, the mutation of the virus, then vaccine really becomes very difficult. And you already mentioned it's already mutating now. And originally there were around 5 strains or something of this coronavirus which was circulating. Do we know how many strains are circulating in our community here in King County? And then because the vaccine becomes a real problem about when it mutates. And my comment is that it's not the responsibility of only some people or only those who are administrating how to control. I think it's the responsibility of each and every person in the population. We all have to do the right thing. And we know from experience by now that the mask and distancing is really working. So why don't we just make it a little compulsory so that business can go hand in hand, because otherwise business will have to be stopped for some more time. So if these two go in balance, I think we'll have less new cases as compared to what we can expect when people are not wearing masks and also not distancing and not quarantining in case they are found to be positive.
Shasti, that's a great comment. Thank you. Patty, there's a couple of questions in there for you.
Yeah, so, I think personal responsibility and how you as a recovery task force going to help your community in that is a really important question. I'll say two things. One of the things in our country that I think is really important is that we've always tried to balance personal responsibility with personal rights. And I think that's a great conversation for you all to have, because this shouldn't be a politicized. I mean, this outbreak, it's not a political statement. Masks are not a political statement. And I think that you all are perfect folks in the community to talk about that and to depoliticize it. I, in public health, people think I sit up here in this ivory tower, and it really is my pleasure to talk directly with the community on this. There are equity concerns around masks that I get concerned about taking too much of an enforcement end, because right now, as we know, with the protests and the data, we can see that people of color can be in certain communities with police. The statistics show that it's not equally enforced. I have a worry of that. So I need to think about all these things. You need to think about it from your community. You know your community and to get these messages out. So I would much prefer that discussion, debate occur with your great guidance, and we find a way to hit that. In terms of the virus mutating, I really don't want you guys to worry about that right now. There's people who are so much smarter than me. We have one of the top vaccine developers here at the University of Washington. What a blessing is that? I got to say, I had a chance to talk to her, and holy smokes, I don't even talk her language. So far be it for me to try and impart anything on that. Your doctor can probably do better than me, but I will say that they're doing a great job in early trials. There's a number of vaccines that are looking very promising, and the pharmaceutical system is, I can tell they're getting more confident. Some of these vaccine trials are going to really become positive. They're starting to gear up so that they can move into production. So I would hold that thought right now. And then I lost your other question. Yeah, daily data. So when we get a daily dump, what we get is raw information on testing. It doesn't have a high percentage of information like where the person was employed. A lot of times it doesn't have home address. A lot of times it doesn't have their race and ethnicity. So it takes my team taking that data every day, and then we deploy through our case and contact tracing to begin to fill in the data. So no, the answer is I apologize. The way our system is set up, it really requires very raw data to come into public health. So I can see on a daily basis how many cases are being identified. I know how many deaths were reported in the day. We are finding in other areas of the country that I think this was actually in Florida, where they're looking back and thinking that a lot of things that were attributed to other things, deaths to other things, are COVID related. Dr. Duchin's already done that work, and we feel pretty confident that our death data is pretty solid for you over time. So we're trying to figure out how to get the way that lab report done to have more data, so you could have more real-time data. But right now, you have to look over that 7-day period, and you'll see that there's these big bars in some of this data that says that it's unknown. And if you look 2 weeks before, it might be 4% right now, and 2 weeks before it was down 5%. That's our work. That's just showing you what we have to do.
Thank you very much. I'm going to call on City Administrator Bobkowitz for a question, and after him, Pavel is up. And also, sorry, I wanted to welcome Grace to the meeting. I see that Grace is here now. Hi, Grace. City Administrator Bobkowitz.
Ms. Hayes, again, thanks for joining us. I have a personal question. I have a 4.5-year-old son who we have kept out of daycare, and we are inching back to going to daycare. What do you know about daycares and transmission for younger children?
Well, being a maternal child nurse by my background, you've asked right to my heart. This virus in children has been such an interesting story, and it's a great example of research and science in action. I would say that we are getting guidance out to daycare as fast as possible, because obviously reopen the economy, good child care, and the ability to work with our youngest little groups there is just really key. So I've got a team that works on a day-to-day basis with child care, early learning centers, trying to get guidance out so that we've got the teachers ready and the parents can get ready. I'm fascinated to look at the emerging science around children and COVID. It's clear that children under the age of 9 not seem to manifest COVID-related illnesses very frequently. That's something we're watching very carefully, and yet we have seen the emergence in the last 2 months of the multi-system problem in children that is, you might have heard it called Kawasaki-like syndrome. It's multi-system, and we are lucky at Seattle Children's to have a lead physician in Kawasaki syndrome who's been consulting all around the country trying to figure out what's going on with children. There doesn't seem to be a way to identify the vulnerabilities of a child to develop that. So we're going to watch that really carefully, which means we still have to protect children. So the mandate that's going to happen in schools, which this reminds me, I'd like to give you all another assignment if could. We need to support our teachers as we look to how schools are going to open. And teachers are going to need to really be supported as they work to keep masks on children in schools. And one of the best strategies, there was a psychologist on 5 just a couple of days ago talking to parents saying, you need to start the summer, take a mask, let them draw on it, put stickers on it, make it fun, practice it now. So that would be a great thing for you to be messaging and being with your teachers and get parents to get kids ready. Because it's not, I don't want to see parents just waiting till the last minute and these poor teachers trying to manage their own masks and a group of kids. So I appreciate being able, Mayor, being able to give out another assignment. Thank you for that.
We love homework, Patty. I'm just scribbling feverishly. That is an excellent idea. There happens to be a school board meeting tonight. I was going to attend on video, and I think now I'm going to make an audience comment. So we'll see how that goes.
Right on.
Really good questions. Thank you, City Administrator Bobkowitz. We have quite a few more. So next is Pavel, I believe, followed by, make sure, yes, Pavel is up, and then Mike after that. Pavel.
All right, thank you. First of all, if I can just say a couple of words to Wally's question. because me and my wife, we own a Montessori preschool in Issaquah, and we get asked all the time, new parents asking, what are you guys doing to prevent virus? What's your routine? What extra stuff you doing? We tell everybody, virus or not, we always, long before all this started, we always maintain the same routine that nowadays we ask everybody to do it. Sterilizing everything, hand washing, cleaning all the time. It's our daily routine. So people should not be scared about daycares. It was always like that. Nothing really changed much. The only thing different is we just spent extra time on wiping computers for check-in and door handles. Everything else been always routine for us.
Thank you, Pavel.
So as for Patty, thank you very much for your presentation and being with us. Personally, for me, I'm absolutely not surprised that we have a raise in number of cases. I think it's natural. People are getting out of their house, people are socializing more. You can't avoid it. It's gonna be like that. Because I'm really proponent of herd immunity rather than immunization in this case. Especially as a scientist, I can tell a lot of things about the RNA virus that puts me in a very uneasy situation whether whatever vaccine they will work out, whether it will be working or not, because mutation rate for those viruses are extremely high. It's almost like I tell my software engineers friends, imagine you write a software program and then every day that software program on every thousandth letter, it gets substitution, what your program will be good at. However, I think we should not really pray for the vaccine. We should really concentrate on our behavior and protect the vulnerable ones. We should always do that, no matter what, in any case. But that's the most important part, I think. My question was actually that I was trying to find the answer that I cannot. Like when in early days, when all this craziness started, like in April, out of all people that were tested, and at the time, only people that had severe, like classic, let's say, symptoms for the COVID were tested, nobody else. More than 90% of those people tested negative for COVID. What do they have?
Good question, Pavel. Thank you.
So I don't know the reference point on your data, which isn't really relevant for them testing negative. One of the things that is true about testing that you'll know is it's all about the timing of it all. And you're right, in the early days, in March in particular, because we were so short in early April, we were so short on testing supplies, we were centering on people who were vulnerable, actually had like pre-existing conditions, were a certain age, et cetera, and were sick. And then as the testing supplies opened up, the state opened it up to anybody that was showing any what we call COVID-like symptoms, or there's a list, of course, CDC has. You know, I think that Dr. Duchin has looked a lot about what was going on during the flu season. We had an uptick in different strains of the flu at different times during the flu season this last year. And he really felt that as one type of flu was in a decrease in January, we were seeing an uptick in influenza A at the same time. So he's been trying to sort out what was happening during flu season during those months, which would include April, as you mentioned. and when COVID was arising and crosswalk between that. So, there's going to be many books written about the pandemic, just like there was in 1918. There'll be plenty of opportunity for graduate students to do their dissertation on this. So I think just keep referring those questions to the University of Washington and to others that are in that space, because we actually need to learn from this as we go. Your point is well taken.
Thank you, Patty. We have 2 more questions lined up, and I'm going to switch to our next speaker because I want to make sure we have enough time to hear about the Swedish hospital story as well. So anybody who has additional questions, please feel free to email them to Joanne afterwards, and Joanne can forward them on to Patty if you think of other things that you'd like to ask. But right now we're going to go to Mike, and our last question today will be from Grace. Mike, you're up.
Great. Thank you, Mayor Pauly, and thank you, Patty, for your great presentation and your leadership through what has been an incredibly challenging time. So I spent a few minutes clicking through the dashboard before we started our meeting today, and I'm just really impressed with the way the information is presented. Very readable and understandable and very interesting, kind of a data wonk. But I did click over, the one that really caught my eye was the panels on kind of the health impacts, the overall health impacts in King County, the social and economic segment. And so a little different question, it is, how is Seattle-King County Public Health working with or informing the social service providers? Because there are some amazing numbers here about increases in need for housing assistance, food assistance, et cetera. It's kind of the community impacts. And is there something that we can do to help support that connectivity?
Oh, what a great question. So thank you for noticing that dashboard. So we actually, EDC put out to a couple of states who they knew had expertise in the area of the social determinants of health to have their data teams do an evaluation specifically on elements. And because my data team had been working with the Accountable Community of Health, which is called Healthier Here now, and we've been the data source for them on social determinants of health for the last 3 years. They gave us that grant. That dashboard you see is the first of our work in this area, which will continue. So I work closely with both the Department of Community and Human Services, who is in contact with the Social Services Network and the various coalitions that have been formed in different areas of the county to bring together those organizations that are serving in the space you're talking about. What we want to do is to begin to take this data dashboard out. Right now, I've been briefing elected officials on it. This was something we used with Dow Constantine from the very beginning. You'll hear him talk more about this. Really is important in looking at the impact when you look at essential workers and the impact of the pandemic on essential workers. And when I'm talking about essential workers, I am talking about those in care, but I'm also talking about the ones in childcare and other essential workers that we've got. So you can use this in terms of your look at reopening and the influence that you see with the natural disparities that we have of the way a pandemic affects groups of people. So that will be a wonderful conversation for you to have. We just posted that dashboard just a few weeks ago as our first step into it. This brand new grant, so we'll be improving it over time. So give me some feedback over time, would be great.
Thank you, Patty. Grace, you're going to wrap this up. What is your question?
Thank you, Madam Mayor, and thank you a lot, Patty, for just coming to speak with us. So I kind of had 2 questions, but I don't think that they're too long. But my first one is that, so I'm a college student, and I know that a lot of kids are going out, and it's just like this is their summer break, so a lot of them are still going out, and they think that they're young, so it's okay. And I'm wondering, I've kind of heard mixed data on how safe being outdoors actually is. Like, how much does that actually minimize the risk? And especially with summer and, the weather's getting nicer, I see lots of teens out just like, on the beach or on the lake. And some people are saying, oh, when you're outside, it's like a super low risk. But I wanted to actually clarify with you, an expert, like what is actually the risk there and like what precautions need to be taken. And then my second question is, when is the time period that the virus is mainly spreading? Is it like when you're showing no symptoms still? Or is it people that have already started showing symptoms, but they don't know it's COVID or they're not really being responsible about it? And so like, in terms of testing, what should prompt you to get a test? Like, I feel like that's kind of hazy right now. Like a lot of people are like, I guess there's testing is more accessible now, but should I be doing it? So
Yeah, and that's an important message for you all as a task force to really think about how you can help with the testing one. So let me start the last question. So we know that people can spread the virus a couple of days before they start with symptoms, which is why we're encouraging people who have been with someone who's tested positive to go ahead and get tested. And it's also why we're doing multiple rounds of testing with things, or some employers are deciding to do like Mariners. They're doing an extremely aggressive testing of their players and staff because they're traveling around, et cetera. So we need to encourage people, obviously, if they're showing symptoms of COVID-like symptoms, to get tested. But if you've been around somebody and or if you've been in a crowd and people weren't social distancing, you're going to see more and more as we get testing more available, encouraging people. And I think some of the healthcare providers are going to be, particularly for vulnerable people, we need to protect those. That's come up a number of times today. And the way we do that is if people are ill, they don't go out. If you do go out, you wear a mask, you social distance, you take care of your family. So we just can't repeat that enough. Going to the outside. So I get this question a lot. I'm glad you asked it. So we know that the virus can be inactivated if it is in bright ultraviolet light. So if you had the virus on your car and your car is sitting outside, that's not a danger right there. But that's really different than if you're with 30 other people standing outside a restaurant waiting to get a table and nobody's wearing a mask and nobody's social distancing. So I'm trying to help people understand the fine nuance on this. When I walk outside and I'm just by myself, and, and I'm in the middle of the road and there's no cars around, nobody's around me, it's not a problem. And they've done some research on people who are running. And when you're running and you're breathing hard, what the plume is, we're trying to figure out the plume. And so if you go on YouTube, you'll see really scary things. But that's why you need to physical distance people. Runners need to be mindful not to run right by people. We need to space out. So the thing about out of doors, you can see that the virus doesn't care that it's 107 degrees in Phoenix right now. It's not dependent on spring, summer, winter, fall. It really is unfortunate. We were hoping. We know that there are some things that deactivate the virus, but it doesn't take the place. And young people, your modeling and the voice you bring for young people to protect themselves right now, because I got to tell you, I know people would feel terrible if their grandma died. Even if they don't get very sick, if they killed their grandma because they brought coronavirus home, they would be devastated. And we have to be blunt and tell those stories because I talk to those families. It's a truth.
Thank you, Patty, and thank you, Grace. Those were excellent questions. I'm just going to do a little time check here. We have 35 minutes left to go. We have another speaker, and we also have our city administrator wanting to do the work plan. So, Patty, I want to thank you for all the work that you're doing. It is amazing for carving out a piece of your day to come and chat with this group, which has been a fantastic help to myself and the city as far as how and when we're going to reopen. Feel free to join us if stay with us. If you'd also like to hear from Chris at Swedish, but if you can't, we totally get it. We are still in a pandemic.
Everybody. Thank you, Mayor.
Thank you,
Best
Patty.
wishes.
Thank you. And now, next up, I would like to introduce Chris Bodwin from Swedish Hospital. He's the Chief Operating Officer. Chris and I have been able to connect throughout this pandemic, both by phone and text, and also jointly did an interview together that we put out on YouTube. And I'm really pleased to have him here today and explain the amazing things that are happening up at Swedish Hospital. Chris.
Thanks for having me, Mayor Polly, and thanks to the task force for your time and commitment and energy to the recovery efforts. I'll just share a little bit about our journey today, and I'm going to share a couple slides with you so you can take a look at them. I think it gives a nice perspective of kind of what's going on locally in the community. So I'm going to try this. We'll see how it works. A little more familiar with Microsoft Teams, which is what we've been using. Tell me when you can see my screen. Can you see that?
We can now see your screen, Chris. Thank you very much.
Okay, I'm going to try and make it even better. Okay, you see the full screen now?
Yes, we do.
Okay, all right. So let me tell you a little bit about what's happened. And even before I start, I'd say that I'm about 100% in agreement with everything that Patty said over the last 45 minutes. So we're pretty much aligned, and we're in constant contact with Department of Health at Swedish. So I can't confirm this, but I'm pretty sure it's true. I think we had the third COVID positive patient in the state of Washington at Swedish Issaquah. So first patient up in Providence, Everett, and then Evergreen. And then we took a patient on February 28th, and this was a gentleman who was transferred to us from downtown Seattle, actually. And this is where it got a little bit scary for us. Particular patient was 28 years old, healthy male, and within 4 hours of entering the hospital, that young gentleman was intubated in the ICU. So that's when we kind of knew that this was going to be a real thing, and might be a little bit scary. So what happened at Issaquah was interesting. We had a big spike within that first week. So on March 6th, our census of COVID patients had jumped to 10. We were having to put enough kind of direct care nursing resources to that we actually canceled elective surgeries a week early at Issaquah so that we could reallocate staff to care for COVID patients coming in. So we canceled elective surgeries and we pivoted. And then, and I'll talk a little bit more about this later. On March 13th, we actually made the decision to close the campus to the public. And then we went to a policy of universal masking all the way back in the middle of March, which is what Governor Inslee has just mandated for the state of Washington now. And if you have questions about how effective that can be, I'll share some data with you in a moment. But universal masking, combined with hand washing is really the key if we're going to safely reopen. March 14th, we started drive-through testing where you could actually call your provider and get an order and pull into your car in the garage at the hospital and get swabbed. And then we went through a period of time where the census, really kind of slowly climbed, and we peaked to a census of 18 on April 4th. And then it was a slow decline from there. We resumed elective surgeries and procedures on May 17th. And yesterday we had 2 patients in the hospital that were COVID positive. We actually went for a week at the beginning of June without any patients in the hospital that were COVID positive. But today we have 4, and we have 5 that are under rule out, which is an increase for us. So as we begin to reopen, we're maybe beginning to see the impacts of a little bit of a resurgence of the virus. And we're also feeling the impact as we've had a couple patients transferred to us through the Regional Crisis Command Center from Yakima as well. So as Yakima becomes overwhelmed, we have a couple patients here. So that's kind of been our journey. It's been, an arduous journey, I would say. A lot of learning, especially in that first 10 days. But I think in terms of how we performed, we've done pretty well. So a few wins to share. We never ran out of personal protective equipment for our caregivers or providers. In fact, although we had significant concerns at certain points around certain items, we never really got close to running out, and our supply chain looks strong for the next 12 months. So that's a real positive. The other thing that was, really an interesting experiment for us was we converted 34 of our inpatient hospital rooms to negative pressure or isolation status. And what that means is that we're able to put a COVID positive patient in there. The air will flow from the hallway into the room and directly out of the room to the outside, or back through our HEPA filters, depending on which unit it's on, in such a way that we're able to provide a higher level of protection for our caregivers that work there. So Issaquah had 12 negative pressure rooms on campus before. We created another 34, and that was in preparation for what we thought would be a surge. And that's kind of the safest environment in which to provide this care. We did do investigational drug clinical trials on site. We're still doing them. So several of our patients have been treated with remdesivir, which Patty mentioned. We never went over our ICU room capacity. We never went over our ventilator capacity. We had a surge plan in place to expand ICU capacity up to 60 beds. Typically our ICU is only 18 beds. And then we just had huge community support. Tons of donations of PPE, tons of meals, tons of encouragement. I mean, it was really great to see the whole community come together to support us. So just to give you an idea of kind of how we've been impacted, been about 80 patients total admitted to the hospital. We've tested 1,000 people or thereabouts in the emergency department, tested a couple thousand in the drive-through clinic. And then since May 17th, system-wide at Swedish, we've been testing everybody prior to them getting or getting a surgery or a procedure. So everybody that's having anything done in one of our operating or procedural suites, whether they're symptomatic or not, is being tested for COVID-19. And that's really a safety mechanism for our caregivers and providers, since those patients often need to be intubated and they have the potential to spew virus during that procedure. So we're only doing surgeries on COVID negative patients, and we're testing to make sure. Now, this last point I think is maybe the most important thing about masking and social distancing. So Swedish has almost 19,000 providers and caregivers system-wide across our 5 hospitals and 100 medical groups locations. We started the universal masking across the system on March 13th. We've only had 170 out of about 19,000 people test positive for COVID-19. Now, we haven't tested everybody. We've only tested the symptomatic people, but that's less than 1% of the total number of people that work at Issaquah. And you have to remember that, at Swedish, many of these people are caring for COVID patients as well. So to have that low a transmission rate over this extended period of time really speaks to how effective masking can be and how effective good cleaning and hygiene processes can be. So when you're talking to people, if they're questioning whether masks are effective, masks are effective. It is the easiest thing we can do next to washing your hands. If you can get people to wear the masks, we can really probably safely reopen, the economy and business and protect people at the same time. So kind of like Patty said, the majority of our patients have been over 60. Interesting for us, a 50-50 split male-female. About a third have required ICU level care. About half of those required ventilator care. Our mortality rate's been about 25% for patients that have entered the hospital. Again, majority of those extremely elderly with a high number of comorbidities. And then AOLS, that meaning doesn't mean it, acronym doesn't mean anything to you. It means average length of stay. And so at Issaquah, typically people that come into the hospital on average will stay about 3.5 days. The average COVID patient stays about 17 days. So that gives you some sense of just how sick these people can be. Part of that is throughput with challenges at the nursing homes, not being able to always take patients back, needing to be negative on COVID before they come back. But long lengths of stay for these patients. And our longest patient, who was actually featured in the Seattle Times, was here for 71 days. was, near death multiple times, but did recover and go home. So it's been an interesting ride for us, but that's kind of been our journey. So what are we doing to keep people safe? Well, a lot of what you heard Patty talk about. So, patients, if they're symptomatic or if they're in rule out, they immediately go into isolation and special precaution for us. And that keeps those patients away from the rest of the patients in the hospital. Issaquah is already a pretty clean hospital. We've certainly upped our cleaning protocols in all areas. And of course, doing hand sanitizing and hand washing, which we're already pretty good at. We're following social distancing in the hospital, just like elsewhere. If you were able to get on the hospital, but you're not, visitors aren't allowed, you'd see that we've taken all the chairs and tables out from Starbucks. Our cafe has far fewer tables in it than it used to. Signage everywhere about physical distancing. Nursing unit break rooms, we're not having people break there so that they can spread out farther. So we're practicing distancing. No visitors on campus unless you have a need to be there as a patient supporter. We have loosened this a little bit in the last 2 weeks. So inpatients can now have a visitor for a limited period of time. And we are allowing COVID positive patients now to have visitors for the first time just in the last week, assuming they are willing to wear the PPE and follow all precautions. And that is new for us. We had not allowed that to this point. But with patients being in the hospital for so long, with the disease being so debilitating, we did a kind of a risk benefit analysis and decided that patient support was maybe the more important thing. And so we've actually changed our stance there. But that's new. Everybody masks. Everybody that enters the facility is screened, temperature and symptom screening, including all providers and caregivers and visitors. If you want to see your doctor, you can come here in person, or you can do a virtual visit as well if you're uncomfortable coming to the hospital. And like I mentioned, we test everybody prior to surgery. So that's kind of what's going on at the hospital. I think the top line there, Swedish is safe, patients are welcome, is true. There's no need to delay care if you need it. It was really scary for a period of time where our emergency department volumes dropped by about 50%. I don't think those strokes and heart attacks disappeared. So when people are not showing up in the emergency department, that's a little concerning. But I want you to know that Swedish is safe and patients are welcome. And, just based on our experience so far, our protocols we have in place, the limited, spread of the virus, even amongst our staff, we feel like we have good protocols in place to keep people safe when they come in and get care. So with that, I am happy to take any questions that the group has for me.
Wow, Chris, thank you. I'm going to let people sign up in the chat with questions, but I just have to tell you at the end of this, I'm hoping to make this the most watched City of Issaquah YouTube ever. I have learned so much today from you and Patty and really feel like I have a good understanding of where we are, and we're still in a really difficult place. And I think that's a great message to get out to the community that, yes, just like Grace said, as the weather's getting better and people are not hearing about it as much, it's becoming a back of mind thing. And what you're telling me is that, and what I heard from Patty is, this is the time for extra vigilance. We need to beat this thing down, and that even just 3 months in, the hospitals now can do many of the things that they used to do and do them safely. And so take care of your health and take care of yourself. And those are really important messages. I am going to go to Shashi first. Shashi has a question.
Yeah, thank you, Chris. A very good presentation. I was just wondering what percentage of cases were from the long-term care and how many were there from people like us from home?
Yeah, so the majority of the cases were from long-term care. Not all of them, though. We had 3 or 4 young males between the ages of mid-20s to mid-30s early on But we haven't had any particularly young people since then. Most of them have been from skilled nursing facilities or, upwards of 60 years old. And that has been challenging not only for us, but for the skilled nursing facilities as well. And I will say our local ones here in Issaquah, Nursing and Rehab down in the Valley and Providence, Marionwood, have actually been really great partners, and have worked really hard to not only keep their residents safe, but not create backlogs in the hospital when we need to get patients to another setting of care. But the majority of those people have been from nursing homes. The majority of the patients that have died have been from nursing homes as well.
Is there any place we can see the data? How many from which nursing home?
I would have to dig it up. I don't have the specifics with me right now. And I probably actually won't share the specifics by nursing home, but the state may have that information if you can glean it there.
Okay, thank you, because I live next to Marianwood.
Yeah, no, I certainly wouldn't be worried about being outside, but we've been in close near them, but we've been in close contact with them. They've implemented many of the same policies and protocols we have to keep their patients safe. Marionwood, I know, has a separate unit where they will care for COVID patients if they need to, as does Issaquah Health and Rehab. But as I said, with a census of about 4, we've seen their numbers go down pretty dramatically over the last several weeks. For a period of time there, many of their patients were the majority of the ones we were treating in the hospital.
Thank you, Shashi. Thank you, Chris. That's great. We have Jason up with a question, followed by Marisol. Jason.
Thank you, Mayor Polly, and thank you, Mr. Bedouin. So one question I had was, it kind of correlates with what I asked our previous guest, which was the rising rates of infection, the rising rate of reproduction, even though the mortality and those rates are going down. Is that a result of better health care as you guys continue to learn more about the virus? She made an interesting comment where she had mentioned that physicians and doctors such as yourselves are no longer recommending intubation unless absolutely necessary, because intubation itself is a very invasive procedure. So are you guys, my hope is, obviously like everybody, is in the next 3 months of this COVID era, you guys will even know more about therapeutics and how to treat. You had mentioned remdesivir, but are you guys seeing things like, even though with climbing infection rates, there's a possibility that if people do come to the hospital, it's not necessarily the death sentence that it originally was in April?
Yeah, so what I'll say is we have and this has evolved over time, but when this all broke, we went into what we call our incident command structure, where the hospital set up their own incident command structures or systems, which included leadership and key physicians and infectious disease experts, but we also reported all that up through system. We have seen decreased hospitalizations over time, and our mortality rate has gone down over time. It's hard for us to attribute whether that's just to learning or whether that's the mix of patients you're getting in and maybe their immunity or their health status when they come in. I don't know that we have a big enough sample size to really know that for sure yet. But what we do know is that as we did the distancing, as people were careful and stayed at home and masked, the hospitalization rate definitely went down. And we have learned things throughout the process. But we have a clinical committee with infectious disease experts, critical care medicine experts, hospitalists. They're having these discussions, almost every day about what the protocols need to be. Do the protocols need to change? And not only are we doing it at Swedish, we're doing it regionally as well. So it's happening with, people are consulting with others at the University of Washington and other hospitals as well. So I'm not sure we have a big enough sample size to know exactly, but I can tell you we have learned. Treatment protocols have changed over time. And we are, I think, doing a good job caring for patients here. But I'm not sure I can fully answer the question directly. It'll be interesting to see what happens, if we do get an increase in cases again. And, maybe we're on the verge of that, maybe not. We'll probably know in the next few days.
Great question, Jason. Chris, I do have to say I find it a little bit amusing when you use the phrase over time. We usually don't use that for a 120-day period. Usually we're thinking like that could be several years or several decades, but the amount of work you guys have been doing in 120 days is astounding. Marisol, I believe you have the next question.
Thank you, Mayor. Yes, I have a question, and I apologize if anybody has asked this. My connection was poorly, and I had to go out. My question is about face mask, and there has been a lot of talk about face mask or face covering, and I wonder if, I'm more worried about the face mask that you can throw away, with one use, and seeing the increase on use of those and how much they pollute. And my question is whether using one that is reusable, if that's help by itself. And I hope I'm being clear. Because I see a lot of people touching it and doing things. And I know this, well, what I understand is why is it protected? But I want you to tell me, if I'm going to talk to someone, how can I explain this? Why is it that the face mask is important? And yeah, that will be my question.
Marisol, that's a great question, and nobody has asked it that way, so thank you very much. Chris?
Yeah, I'll answer it briefly, and then actually what I'll do is, because I looked this up earlier today online, I will, into the chat box, I will put the link to the state of Washington information on this, so you have it. But what Governor Inslee has, proclaimed is that for the general public, you should wear a cloth face mask. So that could be a homemade cloth face mask, and really what the face mask is it's a barrier, and you wear the face mask, mostly to protect others, so that if you cough or spew virus, it it doesn't go any further than it needs to. So he's recommending cloth face masks for the public. He's recommending to preserve the medical grade face masks for medical or healthcare workers. They're both effective. In the hospital, we use medical grade, either a regular surgical face mask or an N95 respirator, depending on what procedure is or how we're providing care. So I will put that in there. But really, what you're doing is you're protecting the potential kind of expulsion of virus particles from your throat and nose. And that's what stops. And that's what the value of the face mask is. So it really is a physical barrier that helps protect people. And based on like the information I showed earlier, if you can, convince people to do that, you really can make a difference. We're just not seeing transmission in the hospital setting at a very high degree based upon the same social distancing principles and masking principles that the governor is asking people to take in the public forum. So people can make a big difference on this just by masking and washing their hands.
Thank you for the question, Marisol. Great answer, Chris. Ron Paul has a question. Ron.
Hi, Chris. Thank you very much. I'm very fascinated with what you were just talking about in terms of masks. Can a person who reuses a cloth mask several times, can that lead to a bacterial infection?
Ron, I'm not a physician, so I'm not sure that I'm the most appropriate person to answer that question. I would have you, that might be a good thing that you chat off to Patty, who's got a clinical background, or I would certainly be happy to, ask one of our providers here and get back to Mary Lou and through her, get that information to you.
I really appreciate that, Chris. And I would remind all of our task force members too, if you do have additional questions, I've got his cell phone number, so I can get to an answer.
But I'm not a
So-
doctor. Just remember that. I'm only so helpful.
That's right. Actually, you're super helpful. Chris, the presentation was excellent. I think the Q&A was great too. And I'm not joking when I say I hope this is the most watched City of Issaquah YouTube ever. You and Patty have painted a very clear picture of where we are and why we need to be vigilant and why we need to take care of each other. So I'm going to promote this wildly on social media, and we will see. So thank you for coming today. We're going to enter into our last item, which is, I think, a relatively short update from our city administrator on the work plan. Wally.
Yes, Madam Mayor, members of the task force, thank you. In the interest of time, really, there's one item I want to focus on. That's the economic recovery piece of this. Jen Davis-Hayes, our economic development manager, is on the line. And I would ask Jen if you wouldn't mind just kind of giving us first a brief overview of the streetery and the plans we have for the next 2 weekends with that, and then also touch on the business assistance grants that the City Council approved the other evening.
Great. Hello, everybody. So we are a day away from the opening or closing of Front Street to allow restaurants to put outdoor seating into the street and onto the sidewalks, as well as other businesses to utilize the outdoor areas for their business operations. So the term streetery is what we're using. It's a term that others have claimed as well. And we're really excited and we appreciate your input in the past to pursue this. So that's going to be the streets are going to be closed starting at 2 p.m. tomorrow. We anticipate then, a few hours for setup, and restaurants will be able to be open for dinner service. The street portion between Dogwood and Sunset along Front Street, and then Alder, half a block on either side, will be closed until Saturday at 10 or 10:30 p.m. So we have an opportunity to go out and safely eat outside with restaurants, and we have about 10 or plus restaurants that are going to be participating, as well as some right outside that area in the Front Street center where Dollar Tree, et cetera, are. So there's some restaurants in there that will be putting out some outdoor seating to add to the mix. I've been saying to people, it's not an event, so don't expect to go down and see music and art. Again, we're still in phase 2. This is about providing businesses the opportunity to have some outdoor seating and outdoor opportunities for their businesses. So we're really excited about that. We're going to be doing that for the next 2 weeks and do an analysis to see if the pros and cons, and if it has worked out well, or we can do some tweaks to make it more successful. We'll do that for the rest of the summer then. Any questions about that before I talk about the grant?
I am not seeing any, Jen, but as you talk about the grants, if some show up, I will recognize the member.
Great. Okay, so another idea that came from, I know that the task force talked about this and some other business folks talked about this, is providing small business grants directly. The city received CARES Act funding from the state and King County, and part of that money has been allocated, $550,000 to provide small business grants up to $10,000. We currently do have the information about the small business grant on our website, so businesses can start to prepare for the application, which we will launch on July 1st. It'll be open for 2 weeks. And we're looking at small businesses, 25 people and employees and less. And you have to be able to show an impact in your income from due to COVID-19. And I have to be physically located in Issaquah. So unfortunately, people outside and unincorporated the city limits would not be eligible. And then we are going to also create a secondary, so that'll be $500,000 worth of small business grants. We're going to create a secondary business grant program with the Economic Vitality Commission working with us. And I know Pavel's on that, and actually Chris is on that as well. And SciCat, with them looking at a business reinvention grant. And so a lot of businesses had to change what they do and how they do it. So a lot of obviously e-commerce and digital platforms, they may have physically had to do some changes to their storefront or their operations. And so we'll talk about ideas like that to think about what we want to fund with those grants and the eligibility and the review criteria. We're going to be having a Economic Vitality Commission meeting on the 15th, and then hope to have that grant announced in the next weeks after that. And that grant again comes from the CARES Act funding from the state and King County. So again, the information about the current grant opportunity is on the website now. Application will be live July 1st and will be due July 15th.
Wally, before we wrap up here, I just want a special thank you to Jen. Jen is our entire economic development team. She's a team of one, and she's doing yeoman's work. And again, the same thing. Amazing things are being done in extremely short periods of time. Lots of constraints, lots of new things, and lots of moving parts. Jen, you've been doing awesome. Thank you so much for the report out. I'm not seeing any questions, so I'm going to turn it back over to City Administrator Bob Cohen.
And let me just echo the thanks to Jen. We've got reinforcements coming. She's hired an economic development specialist who I think is starting July 1st. So we've got reinforcements coming there. Madam Mayor, in the interest of time, I'm happy to answer any questions. We've lined up for the next meeting in 2 weeks, two large destination businesses here in Issaquah to hear about the challenges they have faced. We have the executive director of the Village Theater going to be speaking, as well as the director of the Cougar Mountain Zoo.
Oh, fabulous.
So they're both going to be coming to speak. I do kind of want to react to the discussion here today about masks and, get some feedback in the last few minutes from you, Madam Mayor, and members of the task force about what the staff can be doing in the next 2 weeks. We could certainly talk about it in 2 weeks, but I think that there's probably needs right now. So any feedback that members of the task force have, ideas, I would certainly welcome them. We've got the Streetery this weekend. We've got 4th of July coming up, believe it or not, next week. If there's any ideas of things that we can be doing here in Issaquah to focus people on the importance of masks other than watching the video of this meeting, would certainly welcome.
Well, that's a great suggestion, Wally, because not everybody's a government, junkie like I am, who would spend 90 minutes watching this whole video. But thank you for that. Jason does have a comment, and Marisol does. So I'll just keep you looking at the chat box. Any suggestions and ideas you have, that would be great. So let's go to Jason first.
Thank you again. So as far as the masks, it's interesting because some of the studies are saying that in order to aerosolize the room of this coronavirus, it takes like 10 minutes of talking together without masks and without physical separation, or social distancing. So again, think of being at dinner in an inside area. I don't know, this is just an idea, but what if part of our Buy Local campaign is people at the city, much more talented people than I, but something like a jingle which almost says, 10 minutes to shop, then you must hop, get to the next, something like that, something that's quick and snappy. People understand, okay, unless you're in an eating area and you're doing retail, 10 minutes to shop, then you got to hop and you got to go. So again, to help the retailers, because we want to keep them safe, first and foremost, we want to keep our public safe, we want to keep our retailers safe, and we want to patronize their businesses. That's the most important part, is getting people the confidence to go into these shops and spend their money. So if there's a little jingle that doesn't step on the county's toes or the state's toes, that's, unique to Issaquah, that just kind of reminds people, hey, 10 minutes in, then get out. In a polite way. Like I said, people at the city can figure out the words, but maybe part of our Buy Local campaign is something quick, catchy, that people understand. We want you to patronize, but this isn't the time to browse.
We may just steal some of your words, Jason. That was awesome. Awesome. I love it. Next up, I believe, I want to check, but I think it's Marisol. Marisol.
Hi, everyone. Really quick, and I really like Jason's idea. That's great. I feel like still people don't know where to get masks. This is something that, if you don't know how to sew, you don't get one. And if you don't go out of your house, it's harder to get. So maybe sharing where places where you can buy it, and even local businesses, if they have masks for sale there, like an extra thing. and I
Fabulous.
do.
So a follow-up, if I may, Madam Mayor. The King County has provided us masks. The city has them, the chamber has them. How best to get them out to people? Marisol, what would you suggest?
I would say place them where the people go. I mean, if they go out, I mean, to the farmers market, I will see them there. If you go to a restaurant and they don't have a mask, they are not bringing one because they forgot, have them there. I mean, have them available anywhere. Having like, I think last time they were talking about like putting $1 and you take one kind of thing. I mean,
And we wouldn't even need to do that. I mean, I think it's just a matter of, so if we put them in various places and get that information out. Okay, that's it. Thank you.
Thanks.
Thank you, Marisol. I did get a call or a text from Councilmember Lambert at King County saying she had a whole bunch more masks and what could we do? And I said, bring them into my town. We will figure this out. I'm going to go to Shashi.
Yeah, hi again. Yeah, Jason, your idea has been implemented already in some countries. I know from my own country in India, they give 15 minutes to finish your shopping and make the payment and get out. And as far as possible, no touch. So that's great. I think we should do it here. Secondly, about masks, I think every retail shop can be asked to keep masks. Every business can be asked to keep masks so that there'll be no problem. And other thing, making masks, a lot of people can do it also at home, just making 2 slits and 3 layers of clothing and just put it something better than nothing. Even a scarf would do. And for eating and eatery, I love that streetery. It was wonderful idea. The word is perfect. About restaurants, when people come, I think they should be wearing masks. They should take it out only when they're eating. And when they converse, of course, within a family, all the family group together can talk to each other because they're doing it at home already. But if they're coming with friends and all, maybe they should limit their talking or talk behind the curtain, under the mask, and less talking and quiet eating. So we'll have to adjust and live with it till we have our permanent solutions. So I think that's all I had to say.
Thank you, Shashi. That is great. And Mike, a quick comment on masks.
So yes, real quick, seeing the time. So the one thing that Patty mentioned caught my attention, and that is, getting the kids ready for school and teaching them how to wear masks. So maybe reaching out to the school district and partnering there. Is there some way to, engage the kids now to, teach them to put the masks on, the importance of masking up, etc. And, raising 2 girls and knowing how much peer pressure they create on their parents when they come home from school, when they learn lessons about, being safe and staying, doing proper hygiene, recycling, you name it. So maybe that's another way to get at a different population, getting at the adult population through the kids. So maybe another.
Excellent suggestion. I am not at this point seeing anybody else in the chat box wishing to add in. However, I remind you, just because the meeting is over doesn't mean you can't send your great ideas. So sending those by email would be great. I did want to remind you all that our next meeting is scheduled for July 9th at 4 p.m. And as usual, this was my favorite meeting of the week, favorite meeting of the month. I love the speakers that are coming to talk to you, your reaction to them, your ideas. I feel like our community is really trying to get a hold of this beast and deal with it in an Issaquah way. So thank you so much for all of your input today. And we will see you in a couple of weeks. Thanks all.